This education video will cover the Plan of Care flowsheet. The purpose of the flowsheet is to use clinical practice guidelines or CPGs for planning care. It allows for prioritization and coordination of care and places the patient at the center of our care, shares discipline-specific patient-focused goals across teams, and to ensure optimal outcomes and protect the patient, patient-specific or individualized, and to address the patient holistically. If interventions can be applied to another patient, it is not individualized. We will now discuss the acronym expansion tool for the Plan of Care. You will need to add this in only once, and then you can use it every time you individualized. Locate Preferences, and then Acronym Expansion at the top of your screen. In the bottom of this box, you will choose Import from Other User. Here, we're going to use Nicole Terrazas, as she is the one who created the template. So locate her name within this dropdown. Once you click on her name, you will have access to this Plan of Care. Please place a check mark in the box, then choose OK, and then OK again. Again, this action only needs to be done one time. How to access the Plan of Care flowsheet. You will choose your patient from your patient list, then click on Flowsheets. On the far left, under Flowsheet Selection, choose the Plan of Care flowsheet. We will now discuss adding a CPG or clinical practice guideline. Within the flowsheet, in the gray bar, right-click and choose the option of Add Parameter. This will allow you access to medical, surgical, and human response CPGs. You can maximize the screen to make it easier to view. You will see there are separated headers, the Med Surg and Human Response. You may open them up by using the addition sign next to them. Below the Medical Surgical, you will have a large list of all diagnosis-related clinical practice guidelines. Please note the blue tents next to the actual name of that CPG. If you know the name you're looking for, you may use the search option at the top of the screen. Once you have located it, again, take note of the tents. You do not want to open up or expand and only pull over one portion. You want to pull over all of it by highlighting and choosing Add. So you will notice there are two things that added for our SIRS CPG. Again, we are basing this off of the medical diagnosis. The other option is a human response, again, maximizing the screen, and you will be able to go through that list. Once you have chosen the Add or OK option, you will see how it adds into your flowsheet. It's a green parameter. Let's take a look at the reference data attached to our CPG we just added. You may right-click on the green parameter and choose Show Reference Data. This will show you the CPG for SIRS. It will also show you any CPG that is related to that reference data. Here you will see all of the guidelines that we're following, goals and outcomes, which will attach education and monitoring that our patient is getting towards those goals or outcomes we are setting within our plan of care, and so forth. We have our assessment and intervention, which will go to our flow sheet that will allow us to intervene and document against the plan of care. When we are adding our CPGs, it is important to start with one or the main diagnosis. However, if a patient has multiple diagnoses that are pertinent to their care, it is okay to add multiple CPGs. Just keep in mind that the documentation will expand and you will need to document against it to show that you are following that guideline. The reference data is a really great tool that will allow for some education and how you should be monitoring your patient in relation to the clinical practice guideline you've added. So for SIRS, it will show you all of the monitoring that needs to occur. The last few pages have to do with general information and can be used as a teaching point when you're educating your patient. We will now look at our documentation requirements. Documenting to the plan of care, per policy referenced, is upon admission, all disciplines will complete an assessment or evaluation of their patient within their scope of practice and initiate or contribute to the patient's individualized plan of care. The RN will review the plan of care with a patient, family, and/or significant other upon initiation and once a shift. You will edit the plan of care as needed, and if there is a change, this needs to be reflected. The RN will document on the ANI, the other flow sheet, that the plan of care was reviewed. This will be demonstrated in a moment. We will now discuss individualizing the plan of care, the second piece to our plan of care flow sheet. Remember that acronym that we added. We will now use it. We're going to right-click and add a single time column. This will be done for the first time that you're initiating this plan of care. The date and time do not truly matter. In the blank box, you're going to single click, and then you're going to type in all capital letters POC and hit the Enter key. This will pull in the template that you created or pulled in prior. You will see here that the RN title sits at the top. Please keep in mind that this is not a space for the RN's name, so do not put your name here. It just simply means that this is the RN's plan of care. The template will be used for everyone. If something doesn't apply, we are simply going to put an NA. For our patient and family goals, you will go ahead and set a goal for the patient. For safety and falls, a few examples here. You can put their fall risk, if they have any assistive devices and so forth. Skin can be documented or followed up with our skincare nurses. Activity can be referenced to the BMAT or anything that you would like to put in regards to their activity. For nutrition, this can be their diet or a individualized piece regarding snacks or so forth. For pain, you can put something such as their pain pump, or if they have a preference for pain medication, when they would like it, not just if they have pain or not. If my patient is not in restraints or in isolation, I'm simply going to choose NA or type in NA, but I'm not going to pull those topics out. I'm going to address any urinary or venous catheters. And from a biological standpoint, I'm going to go ahead and address any monitors that are being used for the patient or anything necessary with the patient's care. Here, I'm going to go ahead and place a telemonitor. I can add anything else to this plan of care that I feel is important for an individualization, such as the patient has an advanced directive, they have blood restrictions, or they have blood refusal, if they have any treatment refusals, any diet restrictions, anything like that can be added. Choose OK when complete, disregard the discharge plan, and then choose Save. You will note that there is a blue triangle that you can hover over, and you can view the full plan of care. Keep in mind that any ancillaries will also document in your plan of care so everyone can see the patient's plan. To modify the plan of care, you will simply access the same time column that's already there. This flow sheet will be the only flow sheet that has one working time column. Simply click back into that field. It doesn't matter if you created it or not. Take out the old information and enter the new information. It is really, really important that you keep this as up to date as possible, and it only reflects the current information. Don't worry about erasing somebody else's documentation, as it keeps a history of all documentation. You're going to choose OK. You will note that there is now a C in the corner once you save this documentation, and that's okay. That means something was changed. To show any history of the plan of care, you will right-click and choose the option of Show History. Here you will see a running tally of who entered what and when. So this will allow you to see the changes in the plan of care from the patient's admission to their current stay by simply hovering over those blue triangles. Documenting to the assessment and intervention flow sheet. While it is your responsibility to modify the plan of care on the plan of care flow sheet, it is important that if you change nothing, or even if you modify, you need to say that you looked at the plan of care. This is done on the A&I flow sheet. You will first need to locate the actual green parameter coming from your CPG that states plan of care. Because I've added a SIRS or sepsis, it sits under the interventions for falls and safety. You will see that it is a green parameter, and then it states plan of care. Once you locate this parameter, in your time column, you will document to whether or not you are implementing interventions as appropriate or you're going to revise. So either you're following what's already been set or you need to change it. You're going to choose OK. And then you're going to find the next parameter that is interventions for coping. So here you will see that you can document too that the plan of care was reviewed with the patient, the spouse, significant other, and so forth. Choose what's appropriate, choose OK, and save. And this will conclude the education for our plan of care flow sheet.